I like to be called May Turcotte, but it's Mary. That's my real name. And I live in Fairview Mennonite Home. I've got 7 great-grandchildren. Sheila and Ian had 3 lovely children, and oh, they were wonderful. Never gave her a minute's hard time. My daughter and her husband were in Ecuador, and I just fell. My sandal somehow got stuck, something, I don't know. I don't know why it happened. And down I went backwards, flailing about, looking for something to grab onto. And down I went.
And we got the call that we were going to have a new client come on board. Mary, she had broken her femur. When I came up, Mary was in bed, couldn't move.
But all of a sudden, there you all were, helping me and doing everything for me, and I couldn't believe it.
Home First is about caring for the frail elderly in the comfort of their own home. It's about helping people go from hospital to home with the right services, the right support, the right equipment.
Mary is part of our integrated assisted living program, and she does have access to personal support for her planned and any unplanned needs that may come up 24 hours a day, 7 days a week. And those supports could include professional services such as nursing or the therapies or some personal support service. We know that folks do better at home. They meet their goals faster and they move towards independence, and especially when they're supported by the professional and support staff.
Do you have any medications you have to take today?
Being in hospital is not the ideal setting for frail elderly population. They risk infection, they risk physical deterioration, social isolation. It's not good.
Okay, Mary, how would you like to go for a little walk?
Okay.
All right, let's just go and strengthen those legs.
Having a fractured femur could have went in 2 totally different directions. If you don't have that support and the connections, you're not going to obviously improve like Mary did.
We have seen there a success story after success story of individuals who have told us, I am at home today thanks to Home First.
The program doesn't work on its own. It has to have all of the other providers and partners in it, and the LHINs are the only ones that have both the planning, the capacity, the engagement opportunities, and the agreements.
With the LHINs, our job is to work together to get all of these healthcare providers to work as a team.
If they didn't have programs like this, then there would be clients who would be stuck in the hospitals for days, weeks, months, waiting to get into long-term care, nursing homes, retirement homes. This is their home.
It means everything when you're down to have people helping you.